health, behavior, and society, I think, are the social change, rebel rousers, revolution people.
We think about the real issues that our country's facing right now that are driving some of these extreme health disparities.
At the end of these 5 years, did these women lose the amount of weight that we thought they would in comparison to our comparison group?
When you're thinking about changing a behavior, you've got to figure out a way to put together a whole collection of programs and interventions.
We think about the individual, their families, their communities.
We look for questions that are really on the minds of the public, and then we try and answer those questions and feed them back to those decision makers.
People are contributing to local, national, or global policy making. Any public health topic you're interested in, you're going to find someone here.
Public health is not about the people who sit in offices to do that work, but public health is a work that belongs to the people.
My research is looking at incarceration as a determinant of health. What I love about this department is that I can not only learn about the work, but I can get out into the community and do that work.
We're going to be focused on a lot of different areas. Diabetes, exercise, smoking, HIV, emerging areas like Zika and Ebola.
And then we've got many centers and institutes within the department.
A Center for Communication Programs.
Alcohol, Marketing, and Youth.
Our Institute for Global Tobacco Control.
The Injury Prevention Center. The list goes on and on.
What you're doing here informs how we should be thinking about these issues and why these programs are important.
I really appreciate a collaborative work environment where people are coming together and, as a group doing great things. And I definitely got that sense here.
You're just getting access to terrific experts who are really down-to-earth people and happy to work with students.
Why might the mental health person not have time to answer the questions?
We feel a special obligation and partnership with communities here, so we do a lot of different things in Baltimore.
Something that was really great was following the Engage Baltimore event. It wasn't just the students in our department that cared, it was our faculty right there behind us.
In addition to the terrific local work that we do, we work in a lot of low and middle income countries around the world to try to improve the health of their citizens.
The Hopkins connections go very deep, and that is extremely helpful in terms of applying for jobs.
The students, the staff, the faculty, they want communities to really experience the most wellness that's possible.
It's directly correlated to, what I'm interested in on a scientific level.
I feel as though we have this real opportunity to finally make some positive change and to empower communities to rise within themselves.
I trusted this school with my journey, and that is really important. I don't want to be somewhere where we're just asking really cool questions. I want to ask questions that make a difference.